Thanks, Lee.
Yeah, thanks a lot.
Still ahead on this edition of Eyewitness News Sunday morning, shielding your eyes from the sun's harmful rays and protecting them from a dangerous and common disease.
And
you may not even know it, but when you head out into the sun, there's one part of your body that could be at risk for cancer, and you probably don't even realize. One part that you've probably forgotten about. It is your eyelids. That's right. The area is so delicate, you probably never put sunscreen there. Joining us now is Dr. Amiya Prasad, an ocular plastic surgeon, to tell us more. Doctor, I think about going into the sun, and immediately what comes to mind is wearing sunglasses. Does that do anything to protect your eyelids from the dangers of the sun?
Yes, the sunglasses are a very effective way to protect your eyes. Skin cancer, particularly around the eyes, is very common, and wearing sunscreen and sunglasses will prevent harmful UV light from damaging the skin.
You need sunglasses, however, that cover probably, I would assume, a good portion of your eye.
The more that you're covered, the better off you are.
The better protected. How prevalent is cancer of the eyelid? Is that what it's called, cancer of the eyelid?
Well, it's skin cancer in general, and affecting the face area. Approximately 400,000 cases per year are reported, and 85%, or a very high number, actually affects the eyelid area. The biggest problem with it is that it's often overlooked until it's grown to a significant size because it's so small. It's an area where it can be mistaken for other problems.
Okay, we have a picture, I think. This would be a victim here, I think, of someone who's suffering from cancer of the eyelid?
That's right. This is an individual who has a basal cell carcinoma, which is the most frequent, commonly affected skin cancer affecting the eyelid. And it started as a very small area, and people thought initially it was a sty or an allergy, and it slowly grew and required excision.
What is the warning sign, however, then you should look for as we talk about this, if you're going out in the sun a lot?
Well, a warning sign of an early skin cancer is something that is new, that continues to exist even though you may apply topical antibiotics or warm compresses and things like that. That continues to stay there. People at higher risk are people who have a fair skin and blue eyes, blonde hair, and just if it stays for longer than, let's say, a few months, it should be checked out.
Okay, you answered my next question. People at high risk, why are they more at risk than people with a darker, more olive complexion?
Well, the sun damage that can occur is more readily absorbed by people with darker skin. The melanin, the pigment in the skin, actually absorbs the sunlight and prevents a lot of the damage that can occur from the sun. The lighter skin you have, the less melanin or pigment that absorbs that sunlight is effective. So that way you have someone who's lighter skin is at higher risk for the same amount of sunlight or sun exposure.
We've talked about the problem. Let's talk about the treatment. How do you fix it? How do you prevent yourself from getting to this stage?
Well, prevention is the best thing to do, which is to wear sunblocks, sunglasses, minimize your sun exposure. We're seeing a lot more people at a younger age having these skin cancers, and if it's found, take care of it early.
I would think, doctor, it would be unusual to try and put sunblock on your eyes. Do most people do that, and should you be wary of any risk of getting it in your eyes? That would be uncomfortable.
Sure, most people don't apply sunblock to the eye area, and in fact the bottles often say don't put it around your eyes.
Avoid contact with the eyes.
So, I mean, you can put it on the skin close to the eyelid and close to the edge of the eye without getting it in. If it does end up in your eye, you can easily wash it out. Okay, in addition, you want to also reapply it. People go into the water and then think it's still good. It has to be reapplied. But most effective is the wearing of sunglasses.
I would assume then that the benefit of wearing it is greater than the risk of getting it in your eye.
That's right.
Than the dangers. Okay, very interesting. Dr. Prasad, a pleasure. Thank you so much for joining us this morning in education as hopefully the warmer weather approaches again sometime soon. Back to you.
okay, good advice. Still